Last week, we published guidance that describes how existing polio surveillance networks can be used in the COVID-19 response and outlines the measures that should be put in place to maintain an effective level of surveillance for polio. WHO has also published new guidelines on the use of digital tools for contact tracing. Many digital tools have been developed to assist with contact tracing and case identification. Some are designed for use by public health personnel, like WHO's GoData application, which has been used successfully to trace contacts during the ongoing Ebola outbreak in DRC. Others use GPS or Bluetooth technology to identify those who may have been exposed to an infected person. And still others can be used by people to self-report signs and symptoms of COVID-19. As part of a comprehensive approach, digital contact tracing tools offer the opportunity to trace larger numbers of contacts in a shorter period of time and to provide a real-time picture of the spread of the virus. But they can also pose challenges to privacy, lead to incorrect medical advice based on self-reported symptoms, and can exclude those who do not have access to modern digital technologies. More evidence is needed about the effectiveness of these tools for contact tracing. We encourage countries to gather this evidence as they roll out these tools and to contribute that evidence to the global knowledge base. We also emphasize that digital tools do not replace the human capacity needed to do contact tracing. Starting tomorrow, WHO is convening an online consultation on contact tracing for COVID-19 to share technical and operational experience on contact tracing, including innovations in digital technology. As part of our commitment to coordinating the global response, WHO is also running the COVID-19 Partners Platform, an online tool that enables countries to match needs with resources. This online tool enables countries to enter planned activities for which they need support, and donors to match their contributions to these activities. So far, 105 national plans have been uploaded, and 56 donors have entered their contributions, totaling $3.9 billion. The platform also includes the COVID-19 supply portal, enabling countries to request critical supplies of diagnostics, protective equipment, and other essential medical provisions. So far, WHO has shipped more than 5 million items of personal protective equipment to 110 countries. We're now in the process of shipping more than 129 million items of PPE to 126 countries. More than 6 months into this pandemic, this is not the time for any country to take its foot off the pedal. This is the time for countries to continue to work hard on the basis of science, solutions, and solidarity. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will open the floor now for questions. I will remind journalists to be short and have one question per person so we can take as many as possible. And to remind you that you can ask your question in one of 6 UN languages and Portuguese as well. So first question comes from NHK, a Japanese agency. We have Shoko with us. Shoko, can you hear us?
Hello, Tariq, can you hear me?
Yes.
Okay, thank you. Thank you for taking my question. I have a question regarding the situation in Africa. Dr. Tedros, WHO Regional Director for Africa, Dr. Moeti, mentioned on 7th May that in Africa, COVID-19 won't likely spread as rapidly as other regions in the world, but it will likely smolder in transmission hotspots, and if not controlled, up to 190,000 people could die of COVID-19. Is WHO still in the same position, and what are you concerned about Africa now? Thank you.
Okay, I can begin, and Dr. Tedros may wish to comment after. I think Dr. our regional director was quite clear about her concerns regarding Africa a number of weeks ago, and has been very consistent in her messaging on this. There's still great concern across Africa. We thankfully have not seen a massive acceleration of cases in Africa as yet. Some of that is likely due to a lower availability of testing, but we haven't seen the hospital systems become overwhelmed. What we are seeing in some countries is an acceleration of disease. And again, we're seeing a similar acceleration in parts of South Asia. And we're seeing acceleration of disease now in Central and South America. So I think we need to be very realistic here. We're thankful for the time that is not exponentially rising, because it gives a window of opportunity for preparation and to do more to prepare systems. But that is not to say that the disease cannot explode and that it cannot rise significantly in Africa and cause significant destruction and death. So with regards to the absolute numbers, it's very hard to predict what the numbers will be. What I do know is that those numbers will be lower if we have good surveillance. Those numbers will be lower if we are able to break chains of transmission. Those numbers will be lower if we can get people into healthcare, get them medical oxygen, and get them the supportive care they need. That's what I know. DG, any comment on Africa specifically? Okay.
Thank you very much, Dr. Ryan. Now we will go to Bianca Retier from Globo. Bianca?
Hi, Tarek. Can you hear me?
Yes, very well.
Thanks a lot. My question is about the official data in Brazil. Last week, the Brazilian government pushed back the release of the daily numbers for after the country's main television news program. Then it removed months of data on COVID-19 from the national website, and finally released two contradictory sets of figures for cases and fatalities with totally different results, bringing further confusion. Does the WHO trust the government figures, and how concerned is the WHO with this situation in Brazil? Thanks a lot.
Our understanding is that the government in Brazil will continue to report the important figures, the daily incidents and the daily death figures, and report that in a disaggregated manner. We do have extremely detailed data from PAHO and from Brazil on the epidemic. In fact, some of the data we have from Brazil is some of the most detailed and updated on a daily basis in the world, and we truly hope that that continues. Brazil is a very large country. It has a very diverse population. It has some very vulnerable populations, particularly in peri-urban areas, indigenous populations and others. And therefore, Brazil deserves our full support, and we will continue to support Brazil and the people of Brazil in their fight against COVID. It is, though, at the same time, very important that the messages around transparency and sharing of information are consistent, and that we're able to rely on our partners in Brazil to provide that information to us, but more importantly, to people, to citizens. They need to understand what's happening. They need to understand where the virus is. They need to know how to manage the risks to them. And therefore, we hope and we trust that any confusions that may exist at the moment can be resolved, and that the government of Brazil and the states in Brazil can continue to communicate in a consistent and transparent way with their own citizens in order to bring this epidemic to an end as soon as possible. We will, as I said, continue with our colleagues in PAHO to support